I'm a skin restoration specialist in Newport Beach, California, and welcome back to my nightly show. I am going to go back to doing this again this year. I took a couple weeks off at the end of the year. Hopefully everybody had a really good holiday. But for those who are just joining, I do mostly acne, I do scars, I do pigmentation, and I do a lot with collagen as well. And I want to really showcase all the different things that I do this year, particularly to kind of get a good sense for everybody to really show just what you could do for your skin, for scars, to really provide some hope for patients. A lot of people really struggle with the fact that they've had these scars for a long, long time, and they seem to think that this is a permanent problem. There's never going to be any solution. And it's really nice to be able to kind of have something to showcase for everybody that here's some steps that we could do to improve your, not just your skin, but also your mental health. And it's going to be, just the theme that I'm going to be promoting this year, which is really going to be with all the uncertainty that's out there. Just that there is some hope with certain things, and you can control certain factors in your life. And if you're patient, if you do things the right way, you can get amazing, excellent results with this. And so I'm going to show this particular patient because he's one of my favorite patients ever. I did worked on him years ago. Really patient as well. And that's also the theme that I want to have for everybody tonight. Just about patience is the theme that you're going to hear over and over from me, because I have a lot of people that I've been working on. And every once in a while, there'll be somebody who expects like this significant improvement after a few weeks. And I want to just walk you through just what to expect and why it's unrealistic to expect things to just completely improve after a single session, after just a few weeks. Hey, Dre, yes, I am back. Thank you. I was off for a little bit. Thanks for rejoining us. Again, for those who don't know, who are just joining me again, welcome. This is my live, uncensored talk, unsponsored as well. So I'll be happy to answer really all your questions and without any industry bias or anything like that. I'll just go through really the process for how I do scars, how I do treatments, how I do anything, within the medical world that I try to focus on. I do think that it is worth talking a little bit about microneedling in this context as well. This is a patient, Elisa is asking, is this with microneedling? And, this is not with microneedling. This patient had done microneedling sessions before. This is with really multiple sessions worth of CO2 laser. I did ablative CO2 laser on this patient. I did TCA Cross on this patient. I did talar liberator subcision for this patient. And I did dilute Radiesse and Bellafill. This particular patient, someone's asking how much does it cost? Most patients are about $5,000 to $7,000. This patient needed quite a bit of work over the years. He comes all the way from Puerto Rico for me, so I see him usually about once a year. So he tries to bring it, really tries to combine a few things when he comes over. And in his case, we ended up doing really combination sessions each time, which is a little bit unusual for me because I usually try to just do more TCA crosses in between the sessions. But again, because he was far away, it was really tough. He's also just really trying to save up money each time. And I just wanted to really maximize his improvement. His lasers were tolerated very, very well. I was initially worried because he's a younger patient, and sometimes younger patients don't wear sunblock. They don't wear the sunscreen as well as everybody else. And, he never wore sunscreen before. So I was a little bit concerned the first time I worked on him. But he was a very, interesting patient. He's just, he knew what he wanted in life and just wanted to get this improved and did everything that he needed to do to get this properly done. And I'll tell you, for this particular patient, people are commenting on how his pigmentation improved as well. It was actually, there was a lot of redness for a long time, actually, for about 6 to 8 months initially for most of that redness. It did go down, but there was more redness for this patient. Again, he was actually away from me. He was over in Puerto Rico, where it's hot and it was humid, and so it definitely contributed to that. But he didn't let it get pigmented, which is really nice. He made sure he stayed really good with his sunblock and used the pigmentation cream as well. What's the best treatment for pores? Thinking about doing microneedling. Well, pores is usually more of an oil production issue, so really want to control your oil and do things with things like tretinoin, for example. You could do low dose Accutane, things like that. That would potentially help you. Thank you guys. Thanks for welcoming me back. I appreciate you. Originally, I was going to be off for a couple weeks at the end of the year, and I was thinking I'll be on and still do the lives. But I don't know if you guys were on like that last day, and I was like, I did it for like an hour and a half or so, and I was like, you know what, I'm just gonna be off for 2 weeks now, and I just wanted some alone time with my kids, and just with nothing that's gonna like jump in there at one time, where like alarms come off and I have to worry or stress about anything else. I was just like, that's what I'm gonna do, and it worked out really well. Got fresh up and rejuvenated. Oh, hi, Tichan. Tichan did a procedure with us today, a combination session. She comes on a lot, actually. Hi, Dr. And Jay Dre is saying, hi, Dr. Qazi. What's the risk of keloids with TCA, and can Bellafill really lead to granulomas? Good questions. Two good questions here. So what's the risk of keloids with TCA? So keloids typically are more with things that cause friction, and TCA is not something that's going to particularly cause that. Now, there is a bit of irritation, sometimes a bit of a scabbing. If you have some friction due to rubbing on like a pillowcase, for example, it's really rough. Potentially you may have that, but I've never seen it myself. Really small, little localized spots, I doubt that will be much of a concern for it. Granulomas, more of a, I think that is worth delving into. For some reason, over the last like month, I would say, curiously enough, I've been having a lot more questions, a lot more concern regarding Bellafill, and I do think it's worth going through that and just saying, over and over for patients. Sorry, I'm just going to try to get somebody to block this person who's spamming the thing. So if anybody wants to block the people that are spamming the chat, I don't have the moderators yet. I'm going to start setting up moderators. Anyways, so Bellafill, essentially the way it works is that we have cow collagen, 80% cow collagen, 20% PMMA. And the process sometimes for some patients who have certain autoimmune conditions, for example, you may be concerned that they could develop a granuloma. And, granulomas, I actually have dealt before in the past in patients who had autoimmune conditions for their lungs. There was granulomas in the lungs, but it can really occur on the skin anywhere. And it's a localized reaction a lot of times that sometimes is also due to a superimposed bacteria that's sometimes on the surface there. And so we make sure that's super clean. And then the second thing I usually like to do is make sure that for some patients that, if they have sarcoidosis, for example, or scleroderma, we would not recommend doing something like Bellafill. Now, that being said, I know one of the reps that does Bellafill, she had an autoimmune condition and had done it and had no problems whatsoever. We could do a skin patch test for you if you do have an autoimmune condition and you want to make sure we could do that actually for you. We could wait a month and see to make sure it's totally safe for you. But I really wouldn't do it for patients with scleroderma or sarcoidosis. Those are things that I would that I would avoid. I would avoid Bellafill for those particular patients. Otherwise, though, very, very low risk. I keep it very, very clean over there. I've run into zero granulomas, actually zero, and I can say very comfortably and confidently zero granulomas in my practice. I'm aware of the risk. I pay attention to it. I definitely, take a lot of responsibility in making sure that things are very safe for patients. But I do think it's overblown by a lot of people because they are not comfortable with the way they do filler. And if you look at the way they do filler, just watch it and see what they do and see how they inject. And you'll see that they shouldn't be doing anything permanent. They really never should. Like, it's just, not a good idea. Don't have somebody who has like these, like these ridiculous puffy lips and things like that do permanent filler on you. So it's something to pay attention to. I had a patient the other day. She wanted me to dissolve a bunch of her lips, and she did it from someone local. And, she's just like, I don't know. I thought I was hoping for something natural. And I kind of was like, oh, so you went to who? And she's just like, did she name the person? I was like, okay. She was like looking at me. She's like, yeah, no, I should have realized she's definitely not natural at all. I should have realized that she was going to do that to me too. So definitely pay attention to that, look and see like, okay, if someone's looking at it like really puffy, overdone, it may end up doing it like that for you. So chances are they should avoid, permanent collagen producing products or permanent fillers, things like that, really, because that's their aesthetic and it's not good. Hi, doctor. Do you recommend microneedling for acne and scars? Pretty much never, honestly, almost never. Do I recommend it? Sorry. Let's see here. Doctor, pre-pigmentation cream burns a little, then goes away, then okay using. Yeah, it's okay. It's okay to use it. Just use it, moisturize it afterwards. It's going to be okay. Tips for getting rid of smile lines. Not too many great things, other than collagen, little tiny bits of collagen. And you could try actually silicone tape, put a little silicone tape and just try to put that and support that nasolabial fold. That could potentially help, but I wouldn't say it's like the cure for it. Can we talk a little bit about the psychological aspects of these treatments and of scarring? Yeah, I mean, definitely that's absolutely something that we should talk about. I think it's really that's something that pretty much universally patients will mention is the psychological toll not just acne, but the scars that are left afterwards, what that causes for people. And the biggest thing, really, when you delve into it, nobody really says it just like quite like that. But the biggest thing really is that it really can cause loneliness. That's actually what this could do. And I think that's what needs to be talked a lot about, is that these skin conditions, things that we feel uncomfortable about, whether it's pigmentation, whether it's just aging, just losing collagen, losing elasticity, it really can cause more loneliness. And there's different factors, with that. It's not just the fact that you have the acne, not just the fact that you may have the scars, the residual scars. A lot of times there's other factors involved in there, but it's this added stress that's on there amongst all these other problems now that tips things over the edge. And you may find that you are just a little bit more anxious now, because of a skin condition. And as your skin starts to improve, your anxiety is starting to improve a little bit there. And your social, the way you feel and interact with people is starting to change. You're no longer skeptical of people talking to you and coming up to you and maybe potentially asking you out or just chatting up, and sometimes people felt like they were being bullied or being picked on, or or not even that, just pitied. People don't want to be pitied. People don't want somebody just to come up to them just because they had acne or just because they had scars and feel like somebody just went out of their way to talk to them for that. And there's a lot of that. Now imagine year in and year in, and just like over and over and over, you just feel that way. And it really can cause this anguish that I could say potentially could really diminish people's potential. They could have been going a certain trajectory in life, but then because of the acne, because of the scars, they just feel like they can't, succeed as well. And now they just can't really hang out as much, and maybe they don't go do as well at work anymore because of things like that. And it really does actually affect so many different layers of people's lives. And it's interesting. It's an interesting phenomenon. It's one of the few things out there that really does affect so many different pathways of your life. And, not just your job, not just your relationships, not just, even your parents sometimes make unnecessary comments, things like that. One of my patients today was saying that, a parent had mentioned what you got to fix it. Another person mentioned that their ex-boyfriend had mentioned it. That's terrible, that I guess that's why they're ex-boyfriend, but like the ex-boyfriend mentioned that you really need to go fix like the pimples on your face or something like that. And that's why they're seeing me for that. That's really, there's pathology involved with the ex-boyfriend, but it's obviously it still affects people because it's like, you still think that, okay, that was something that I was a little insecure about. And they did dig at that particular spot. And they knew it, they knew what they were doing with it, but they did it. They went right at that spot, that weakest point for you, and they did it. and it like sometimes just chips away at you. And then there's people out there. There's a lot of people that you encounter all day long, and you'll see so many times. You'll do a lot of consultations. Feel free to do a lot of consultations, and you'll meet them and you'll see how they interact with you and how they try to sort of like put you down a bit and make you feel less comfortable and confident, because they know that like this is a vulnerable thing, and we could be able to get a little bit of money off of somebody. They're going to be willing to put some money involved into getting some sort of result or some sort of hope for this. And they'll do like the Andrew Tate model of like negging or something, and that's their style. And it's like I've heard a lot from a lot of patients that say that. A lot of people say that type of thing. It's like that's their style. Like they went through Andrew Tate's Hustler University, and they found that the best way to do things to get attention from people is to neg them. And then they were like, oh, that's how I could get. I was actually negged. I told you I was like went to a really prominent plastic surgeon in Chicago, and he was negging me. He literally was like, negging before negging was even something. It's like he just knew how to do it. Yeah, there's certain people that get drawn to this world, and that succeed because they're sociopathic. And they're borderline psychopathic. Sometimes they enjoy it. Sometimes not just the fact that they don't have empathy, but sometimes they actually enjoy the fact that like they could pick at people and like and do that to someone. It's crazy. It's crazy that in our world those particular people are elevated because there's no real like consequences. They just lie and lie and lie through their teeth all day long, and like there's really like just like nothing that happens to like so many things in our society anymore. People just lie and just like, I don't know. It's crazy. It's like, and that's why people there's such little trust out there anymore. Echo saying, how many sessions did it take to get that process? This took about 4 sessions, different things, so not necessarily the same thing over and over again. I did do multiple sessions in his case of CO2, ablative CO2 laser. So the CO2 that I had to use is essentially for the thicker portions of the scar. So you can see it's very, very thick around there. And we had to do a lot to actually remodel and restructure that. It took a lot of work to really actually individually smooth that down. And then I did TCA Cross, and I did multiple sessions of TCA Cross. I also did Bellafill, dilute Radiesse for him. It was excellent. You can't really appreciate in this photo. He was actually only 20, 21 when I first started seeing him, but already he was having a little bit of loose skin due to his scarring. It was really interesting, and that's why I ended up doing some of the dilute Radiesse, because it does tighten some of the skin. It does stimulate more elastin production. Is tretinoin 0.05 helpful? Yes, it definitely will help out with oil production and preventing acne. I wouldn't help too much with scars, but it does help with that portion though. So it's definitely a good idea, just to put it in your regimen. It's going to help with some of the diameter of the scar, narrowing that. That's going to help with that. I can tell when people are really staring hard. It's a terrible feeling. I'm sorry, that's the case that you're noticing it, because I should say, you know what? I'm not sorry that you're noticing it. I shouldn't say that. I'm sorry that we live in a world where people do that. I should say that. That's actually the real thing. It's not that you're noticing. It's actually, I'm sorry that we have this world, honestly, sometimes, because it's really unfortunate. And everyone says that we just have to accept things, accept it. It's like, why do we have to accept everything? Honestly, I don't know. Like, why is it that we just have to accept the way the world is? Like, I don't understand that. Clearly, it's like you keep accepting it, and it's just getting worse and worse. I'll tell you, like, I'm like 42 years old. And it's kind of worse and worse and worse. So it's like we were told to, like, our school, which, by the way, like, our textbook was written by Ghislaine Maxwell's father, just FYI. Anyway, so he was like the publisher. But like which is an interesting thing. McGraw textbooks were owned by him. But like, it's interesting how they made it seem as if like you just had to be like complacent and passive and just like go with the flow, and like that's how you could be like and get by in society, instead of like trying to like look at this and like look at it and objectively and say like maybe we should try to be better than this and improve this as like a society and better for everybody. And I don't know why we haven't pushed that enough. I don't know. Hello, I just did a deep CO2 treatment in PRP. Do you think it's effective for pitted scars? Well, the PRP helps with the healing, but it's not going to help so much with the scars. So not going to help too much with that portion of things. But CO2 probably it'll help somewhat for some of the scars. So what the CO2 helps with, if you look over here for this patient, and this is actually, I want you to think of, if you get anything from this talk, get this right here. So A lot of people are going to say CO2 laser are for those deep pockets, those deep scar, the atrophic scarring. So yes, sure, it's going to stimulate some collagen production and do that. Sure. But the actual thing it's really going to be doing, well, the way I do it is with an ablative surgical piece, basically. I'm fully breaking down the thicker edges of the scar. I don't really see, I mean, maybe there's someone now that's doing it, but like I haven't really seen anybody else do this. I'm not sure, why not? Because it's the most, when I was looking at my own scars, that's the thing that I realized is going to improve it. And that's what I realized. I was looking at it and I was like, there's these thick edges around there. And I did 6 Fraxel lasers and I did 6 microneedling sessions and it didn't solve the thick edges. So clearly, like what we're doing isn't working. And, whatever they're saying isn't like the best. And so I was like, what is a better option? And like, I did actually look into like deep peels, like phenol, but they said my skin color, was too dark and I would get like hypopigmentation. And so it wasn't until I got my own hands on lasers that I figured out that like, there's a way you can be super precise, just go right at the edges of these scars and really smooth them down. And that's what we could do. And that's how we did this right here. That's how you do it. You go trace along the edges of these scars. And it's interesting actually, because you do that and then you actually make sure that you have a little bit of silicone tape afterwards to help prevent friction, for example, prevent the hypertrophy afterwards from developing later on. And it works incredibly well. It's just that sometimes you have to do it a few times. This patient had very, very thick skin. You have to do it a few times for him. How do you know the after pick didn't have post-intervention edema? Well, this is a year or two. I've been working on this patient for I've seen him for 4 years now, I think, at this point. So yeah, this is not any recent time. This is probably, I don't remember. Let's see. I don't know if I put it up there or not. Let me double check. But it's definitely not, this is, that's usually about a month of that. This is not a month. This is, like I said, I see him about once. The first year I saw him, I think like twice a year. And then now I see him maybe like once a year or something like that, just for like a little bit here and there. But no, there is filler in here. This is Bellafill as well. There's no way of solving your scars if there's fat loss without doing some volume. I don't think that that's emphasized enough. If you have true volume loss, you have to do something for the volume. And we had to do that. And we did Bellafill, which 20% of it does stay there and it continues to stay there. And the rest of it continues to make some collagen. So the 20% there, and then you just made some collagen around it. And so you have a little bit more improvement there. And then I also did dilute Radiesse as well, because I wanted to improve his skin quality. And also I wanted to make sure that we could get a little bit of a volumization there. Aziz is saying, deciding as a team between adapalene and SPF for anti-aging maintenance versus tretinoin with sensitive skin. So it depends if you're just looking for just anti-aging and maintenance. Adapalene, SPF, great options there really. Tretinoin maybe a little bit too harsh for you. Adapalene, easy over-the-counter type of thing too. You don't have to get prescriptions for that then. So something you could just stick with then really continuously. Where in California are we located? I'm in Newport Beach, California, so Orange County, just about 10 minutes away from the airport. So how many years in between the photos? I believe this is 1 year of this for this photo. I got to double check. Actually, let me just pull it up again I had this one on. Give me a moment. If I could try to pull it while I'm talking, I'll do it. Otherwise, I'll try to bring it up tomorrow to see and have the team kind of pull up all the different times that we did. We don't have the actual timeline here for him, so I'll try to pull it up. I know I've been working on it for years and years, so I don't know exactly offhand for here. I believe this is going to be at least a year though for him though, so I just got to double check though. Is percentage of TCA on ice pick scars? Well, it could range anywhere from 30 to 90% or so. Depends on how deep the scar is. Tichan is saying, should I be limiting movement of my facial muscle? Skin feels hard after collagen mask and sunscreen. So Tichan just did a combination session today, all really puffy, swollen, and it's totally normal. That you don't have to worry too much about movement, things like that. Just feel comfortable, but you do want to actually make sure that you're elevated a bit when you're sleeping. So just stay a little bit elevated. You're going to have a little bit of some oozing sometimes that happens as well. So try to sometimes put a little bit of a towel behind you as well. So that's going to help you out. And that's normal for the first day, but your one side was really puffy. Actually, it was the left side for you, was really stuck actually there. So we had to break that up a little bit more. So you'll know that side is going to be a little bit more stiff. But it was good. We broke it up. We broke it up really successfully. That was a lot of stuck scars there. And interestingly enough, for her, Asian patient, it was really stuck on one side. Back scars, ice pick scars, more stuck than I expected, actually. Usually you see that for men and more of like deeper rolling scars. But her scars were like just very, very stuck and thick back scars. So we did have to do that subcision, improved it a lot though. You could feel that release and it's just immediately going to improve that there. So that's going to be awesome. Let's see here. I saw a few more things here. Let's see. I missed a bunch of things. What kind of moisturizer would be best for this texture type? Well, no moisturizer is going to solve this, unfortunately. You'll see these people with these Amazon affiliate links, and they're going to try to push, like beef tallow or something like that for this. So the results in the Bellafill will stick. Yeah, it'll stick. You definitely are going to have some volume loss as you get older, though. So you're going to still want to improve those pockets of fat loss with more Bellafill or something else for that. But I know that everybody says, well, Bellafill or a filler isn't permanent, things like that. But you have to do something for volume. You have to do something for volume. And Bellafill is the most permanent option you could do. So that's the best option and the most permanent option is going to be Bellafill. Otherwise, I don't know what else you're potentially going to do for volume. It's like, yes, of course, do fat transfer if you have fat. But a lot of my patients don't have much fat. It's like a lot of people don't have much fat. So it's like, what are you going to do? You got to do some volume. What do you think of Fraxel? So it depends on the kind of Fraxel. I mean, I did a Fraxel 1550 Fraxel Restore on my face. It did it 6 times. It did really nothing for my scars. And Fraxel Dual can help a little bit with the pigmentation. Not going to help so much for this. So, how often do you recommend patients making an appointment for Bellafill? We'll usually just get that correction, and then we'll just wait afterwards to see if we need to do much more. So once we get the correction, I usually do that every 3 months or so. Get you coming in, see where we need to put a little bit more and put a little bit more in there. And then we could see if we need to do any more Bellafill after that. I usually don't do too much more than that, though. Audrey's saying, do at-home red light therapy masks do anything for collagen production? It does. It's just, yeah, it does. I mean, it's great for burns in general. The only thing is that I get worried about pigmentation issues for patients with a red light therapy. That's the one thing. There's no way. The only way to fix this is injections. There has to be a natural remedy. Well, it's not the only way. We have to do laser. We have to do TCA Cross. We have to do Subcision. So we have to do all those different things. But you don't get more natural than like a calcium filler. So you can do calcium, you can do fat. You can do fat. You don't get more natural. I should say you don't get more. The most natural is going to be fat. So that's going to help you out. Volume is really important, though. You really do need to do that. I don't know, why there's so much hesitation with it. To be honest with you, I do kind of want to see why so many people are so worried about it. Because if you look at it, you'll see that there is volume loss due to your scars. You'll look at the areas where you have scars, and you'll notice that those are the areas that there's indentations. And those are the areas where even if you break up the scar tissue, there's still fat transfer. Hey, Joey, how's it going? Yes, we are so back. It was good. It was a good break, but I did actually miss kind of talking to. I was actually really excited to come on tonight, though, too. Do sun visors work? Yeah, you should see me all the time. I'm wearing. See me in the hall, at the mall sometime. I'll be just completely visored up there. Can this acne be reduced using any lotions? So this is not acne anymore. This is just scars, and the scars are not. These particular scars like this are not going to be improved like that. What areas of the face should be avoided when doing subcision due to risk of sagging? Well, it's about the way the person is doing it and potentially the kinds of scars that are being treated. But certainly the lower part of the face is the riskiest area, and along the jowl area, the riskiest area for subcision. You could still do subcision, though. I do subcision, though. I usually don't use as thick of a cannula. I pretty much almost never use blunt tools, sharp tools, such as like a Taylor Liberator. If it's like for a small localized area, I may do for like a Noker needle for some areas, or just like either or other sorts of needles. And sometimes I'll just use a different gauge of the cannula for that area. But that is definitely the more risky area for subcision. Honestly, to be totally honest with you, there's very, very few people in the world who do much subcision like properly. And so it's not so much that like what you do to avoid subcision, things like that. It's just the practitioner. A lot of things are about the practitioner. and how they're doing it. I'm not saying that it's like impossible to get negative side effects, things like that. But there's a lot of focus that's involved with this, a lot more focus than people expect. And that's why I think that it's not for everybody. And whatever you could focus on, whatever you could excel at, you should do. If this is not the thing that you could focus on, the thing that you could do very, very well and do very, very safely over and over and over again, it's not something you should be doing. You know, there's people that just zone out. A lot of times you see them, they're zoned out when they're doing these treatments. What treatments are done on this patient? We did TCA Cross. We did Subcision for this patient. We did ablative CO2 laser, fractionated CO2 laser, and erbium laser as well for this patient. And I think I mentioned the dilute Radiesse, but dilute Radiesse as well as Bellafill. Those are all things. I thought this was from being a face sleeper. No, this is genetic, really. I mean, tragically, this is somebody who just, his genes meant that when he had acne, it would just his body would have a terrible reaction. It would be almost like an autoimmune reaction that just attacks it, and attacks it so severely that it caused scarring and severe scars for him. And just imagine, you know, only 20 years old, 21 years old when he came to me, and had such severe scars, such thick scars already at that age. And it was, you know, a destruction of his confidence. And he just like knew like what he wanted to do. He was like, he came all the way from Puerto Rico to try to work on that. Jenna Green is saying, have you had success with Accure used in the upper chest? On the upper chest, yes, we have done it for the upper chest for the sternum area. That is correct. We have absolutely no problem for that, as well as the back area. And then we've also done it for some patients along the neck area as well. It depends on how much acne is in those areas, though. I wouldn't necessarily just be doing it just for little bits of it. That's usually just more topical creams. But if it's really severe cystic acne in a localized area, Accure could work really well. How much does it cost this treatment patient for all procedures you just mentioned? Well, this patient, he had very, very severe scars. So if you had very severe scars like this and you need multiple sessions, combination sessions, so he did do it it was about $12,000 to $18,000 probably for this patient. This was before, though, that I did my warranty program. So I did this years and years ago, and now more recently, we introduced our warranty program. Hopefully, you guys are aware of it. You guys know about the warranty program, right? Where future sessions for scars, for lasers, for TCA Cross, after you do the combination session, they're up to 55% off. Honestly, it's because of situations like this. That's why I wanted to do that. Really, it was because like I had very, very, very severe cases, and I just wanted to solve it. And I was like, I just need to solve it for some people that just like, I know that they're saving up for things and stuff like that. But like, it was just like, it's like a real like mission sometimes for me. Like, it's just like, I don't know, you just look at it and you want to just solve it and just get that there. And this is a patient that's pretty close to solved. He still feels like there's, you know, you can still see there's a little bit of like some areas where we can still fix it a little bit more. And it's awesome that those are the little bits of issues that he's worried about at this point in life. That's pretty cool. That's a pretty cool feeling that he had such severe scars at one point, and now years later, he's looking at it like he hardly has to worry about that. And we can get there, just a slower process than people may think. And that's what I actually wanted to showcase for you. Just, you know, a lot of times I talk to you, I show you more of like the progress report patients, people that are in the middle of the treatments, things like that. Actually, you know, a lot of times you don't see patients afterwards because most people are just like, they're good at a point. They know it's not perfect, but they're at a point where it's like no longer affecting their day-to-day life. It hardly affects them. You know, even to me, like sometimes if I go into, you know, like I was in Spain and they had like in the elevator, it was like the worst lighting in the world. And I was looking at my face and I was like, man, do I really just have like these shadows and all that stuff? And it's like, gosh, this lighting, like, is this what I look like? And it just like brings you down for a moment. They're just sitting there in the elevator. I was just looking at myself. It's like, gosh. And then I like walked out and I'm like, looked at myself in the hallway mirror and I'm like, I don't know. Is this like what I look like? I don't know. I don't even know anymore right now. And it just messes with you. Like sometimes the lighting messes with you and stuff like that, and just brings you down for this moment. And you just have to like catch yourself and like realize that this is just not the real world. Like that elevator light, whatever random reason they did that, I don't know why they did it that way. Nobody knows like why they do an elevator light like that and why they do dressing room light like that. I don't know, but they did it like that. And it's like, yeah, it brings you down for like this moment. And like, if you have like terrible scars and stuff like that, like it'll really like just crush you. Like there goes your day. Like you're just like, everything was going bad. And now like you see this situation and just like, it looks really bad. So honestly, that has happened to me. I was like looking at myself and I was like, gosh, is that like, and my mom was with me. My mom looks amazing. She's in her 60s and she looks amazing. And she's like, oh, this elevator is really bad. Like, I guess that's, I guess I do look my age now. And I'm like, no, this elevator is just the worst. Like, we just got to get rid of the lights of the elevator. Like, almost like, and just like destroy this. Like, because this is, it brings you down. It brings you down and depresses people. And like, it does it to everybody. And it's crazy. And it's crazy how it affects us all the time. And you think that you're immune to it and you're not immune to it. Almost everybody is immune to it in some, or everybody gets affected to it by it at some point. And so even the people, like you'll look at some people and they're very, very attractive patients that come to us and they'll say they just have 1 or 2 scars, things like that. And someone else will say, well, like what's that? Like I would kill for those 1 or 2 scars, but it's still like really depressing for that person. Like everything was going well and then they had a scar and now it affects their life. It affects their quality of life. And, maybe like they see like harsh lighting all the time or they just have annoying friends around them. A lot of times though, it turns out that like, a lot of people are just really annoying. A lot of people. And like you kind of just use this as a way just to get rid of them because it's like these guys, like, I don't know what their comments are. Like, why did that patient's ex-boyfriend comment on the patient's pimples and say that she needs to go get that fixed? It's just, it's outrageous behavior. And like husbands, a lot of times actually, people will have like partners or something like that will help pay for some of these treatments, and they're like putting a lot of pressure for like the first couple of weeks, like or so. I don't see a difference. I don't see a thing. I don't this, that, and it's like making it more stressed out for you. Now you got to kind of prove yourself that like you're like an independent person and you didn't get like hoodwinked or something like that. And it's like, man, just like settle down. It's like, just relax. Yeah, it's not like you don't look at yourself with a flashlight all the time. Just one moment you're gonna like remember that you had scars, and then another moment, like a year from now, a year and a half later, you're gonna be like looking at yourself in most day-to-day mirrors, and you're gonna be like, oh, I actually do like look like really good actually right now. It's just like the lighting right now, what's going on, and people are going to comment a little bit more, and it's going to slowly dawn on you that your skin looks a lot better. And it happened, and it was a slower process than you expected. And it's pretty cool though when it happens, but like during that journey in the middle, it's like a little stressful for people. Does Bellafill migrate? I haven't seen any evidence in my practice of it migrating, so I do not have that problem. PRF for acne scars. I don't recommend it for acne scars. I don't think it's going to be helpful for acne scars. I think it helps a little bit for the just the healing process of it, but it's not something that I push at all for scars. When I was first starting my practice, I was really told by a lot of people, a lot of charlatans, a lot of snake oil salesmen who were just making all sorts of claims about PRP, like, oh, this microneedling PRP was going to solve things. I was already skeptical of microneedling because I did microneedling my own scars. I knew that didn't work. But I was like, okay, I guess maybe I didn't do PRP. Maybe that's why things weren't working enough and things like that. So I was checking a look and seeing like maybe there's and a lot of these scars. A lot of people were telling me like do microneedling with PRP, do radio frequency microneedling with PRP. I didn't really find that it was enough. Like maybe it helped a little bit with skin texture a little bit, but certainly not enough for the scars. And then with radio frequency microneedling, the problem is you have to use so much heat and so much energy you could cause volume loss there. Where was I 30 years ago? That's a good question. Honestly, I wish that there were always people like this, like not just like me, but like just in life. Just like I wish that like when I was growing up, I had somebody who was accessible and was talking and like was just explaining stuff. It would be really nice. Like when I was growing up, I thought, and that's why I wanted to do this. And that's why I'm just going to continue doing this because it's just like I felt like it was really important. I really did feel, when I was growing up, that there was a lot of misinformation and a lot of confusion about things, and we were gonna get like this enlightened period in time when all this technology would come out, and so many doctors would be just like teaching us like the really good things and all these things, and capitalism killed it. It just did. It killed it. It like destroyed it. It destroyed that hope because you realized that like these guys just like got bought out. They got bought out by the laser companies. They got bought out by whoever, like some PRP company. Well, it didn't even cost like charge that much to get bought out. Honestly, like it turns out like it was just like some like free things here and there, and like maybe like a trip or something like that. And like now they're like pushing like some bunch of nonsense stuff, and that's all it took for them to do. It's like. At least like ask for more money if you're gonna get bought out like that, dude. You just like put like everything out there, and like there you go for like a couple $1,000s, something like that, for destroying your reputation and getting people to do useless treatments. Great work with that. Nano fat for acne scars, does it work? I think it'll help with the collagen response there, but not so much like just by itself as an end all be all for acne scars. I wouldn't really push it that way. Does Bellafill have problems if patients get it, but then years later gains or loses weight? Really good question. So for myself, like I really don't have much fat, like body fat, and when I do lose a little bit of weight, it's like really obvious. In fact, I actually had norovirus actually, and it was like a couple weeks ago, and I was like, just going on vacation. There goes that vacation for that week. But like, and I lost a lot of weight there, and it was usually like super evident on my face. I just got super sunken and hollowed out. But the Bellafill is like there and it supported my face still. So it's like pretty cool that you always have some support there. Really nice. Really nice that you're always going to have something there. So I haven't noticed any problems with that, weight fluctuations, anything like that. How to know if red spots on a white skin are PIE or PIH? Well, if they're red spots like that, they are going to be more like PIE. You could usually see like a little trace linear line. Sometimes if you look at it really, really closely, you could be able to see that. What was the treatment for this patient? So this patient, we did a combination of different treatments. This was with collagen-stimulating products. We did Subcision. We did ablative CO2 laser. We did TCA Cross. We did dilute Radiesse, Bellafill, all those. Does weight loss make acne scars more noticeable? Yes, absolutely it could. You a lot of times will notice that your fat was actually supporting some of your scars. As you lost some of the fat, you'll see some of that indentation there, which is a problem really for a lot of patients. As they get older, you'll see, a lot of patients in their 40s and 50s actually come to me because things were okay for a little bit of time and they had some plumpness, and then they started noticing as the fat loss started to go that they have a lot more scarring. And they're like, did the scars get worse? No, they were there. It was just always underneath there. That's the problem with it, actually, honestly. Let's see here. What was the price for this patient? I can't say ever, anytime we have any patient, I'm never going to say the exact price for any particular patient. I'll say most patients spend about $5,000 to $7,000 for the scars. This particular patient wanted pretty close to as close to excellent results as possible, as smooth as possible for him. And his were about $12,000 to $18,000 for that, probably around there for him. And we did a few different things in his case. So most patients, though, about $5,000 to $7,000 for the scars. Can BBL be done on the neck? Yes, it could be done on the neck, especially for acne. It's absolutely no problem. We could do it for that way. Let's see. Why do some scars have white marks in the center? I have a few like that. Well, it's actually a little bit of scarring there that's lost some of the pigmentation as well. So you've lost a little bit of the melanocytes. Sometimes we can trigger those melanocytes, though. I have a very good case, actually. She may let us share results as well. She has lupus. Her scars are not due from acne. It's actually due to lupus and cause severe scarring, atrophic scarring, plus these hypopigmented areas. I did laser on her as well as a few different other things, and we did actually wake up a lot of the melanocytes. It's really cool, actually. You have less of the hypopigmentation. Was Blent, Cannula, and Bellafill used for subcision at the jawline area? Yes, at the jawline area it was, exactly. Jawline area is very, very tricky. I actually pretty much never use, I can think of really no time that I've used tear liberator or like a sharper, deeper tool like that in the jawline. So it really is a Blent, Cannula subcision there. Where should I stop? Or where should I shop CO2? Because I'm not sure how to read that. Maybe if you could say it a different way, in more less phonetic and just spell it out the words properly. Rukia saying, how long does it take to see results? A year and a half. Pretty much everybody says that. Almost everybody will say it. I would say for my own self too, it took me about a year and a half, really. Thoughts on Accure laser for cystic acne? It's awesome for cystic acne. It's awesome. It's for moderate to severe acne. It's excellent for that. And we usually do want to use something like broadband light to kill the surface bacteria. We do that at the same time. So both work incredibly well. There's still sometimes this bacterial component that we have to solve with acne. I'll help you out with that as well. What happens if you can't break the bonds in the jawline area with a blunt cannula? So that's one of the few times I may have to do subcision again in the jawline area. So we may have to do that again. I'll let you know. Maybe we have to go through do subcision again over there. There's also like the parotid gland over there. You definitely, I see people when they're doing these sharp tools. I don't know sometimes with that area, really risky. Sure you could do it. You run in the right plane. I'm sure you could do it that way, but it's tough. It's tough. Wait, not 6 months to see results. Does it end up looking worse at the beginning? Yeah, it could look a little bit worse in the beginning. 6 months is really just like that initial threshold where you start seeing it, honestly. It's not like you saw the result. It's like the initial result. It's very confusing for people. It just depends on what you've gotten done, too. Honestly, it depends. Like, what did you get done? Was it something that stimulated enough collagen? I'm not sure. If it's not something that stimulates enough collagen, then maybe 6 months isn't really necessary. But if it is something that you were doing to stimulate more collagen, then yes, it is a year and a half later to see that improvement. But if like somebody just like sold you a package, my patient today, actually, they did 20 to 30 lasers, and they did 11 subcision sessions. Can you believe that? She came all the way from Romania. She flew in from Romania. She did it over in Romania. She did it all over Europe. She said, but 20 to 30 laser sessions. She said it may have been even more than that. And it's sad, actually. Just think about that. Think about what she had to go through. And she did 11 subcision sessions. She did, I think it was also with the subcision, she said it was like Genius radio frequency microneedling. She did that each time too. So she did about 10 of that as well. I can't believe it. It was like, it's so sad. It's so unfortunate. First, when I did the video consultation, I did tell her that maybe there'd be areas of subcision that we may have to do still. Sorry, because I know you did 11 sessions. She came in, there definitely were a couple spots. I had to do I had to break it up. She did 11 subcisions and I still had to break up the scars. It still was not done properly. Just can you believe that? So, I don't know. Sometimes it's like, I'm not sure. Just because you did something doesn't mean necessarily like, although in that case, like that wasn't her fault at all. But she did 11 subcisions, but that's the red flag by itself though. The fact that somebody was doing that many subcision sessions on you is really concerning. 11 subcisions is insane. It is. It's like, it's not normal. It shouldn't be standard of care. And I understand that, everybody's got different techniques and stuff like that, but this is an invasive procedure. I mean, maybe just like up your skills a bit and try to get that better because I'm not sure what happened there. I don't know. What's going on? Maybe like do something else. Is BBL laser done after every Accure laser session, and is it complimentary? No, it's just $100 though. It's like $99 just to do it with it. And so yeah, you could do BBL, and this doesn't have to be always done with it. It's just when you have active acne. Victor's saying, can you do a Accure laser if you have no active acne but lots of oil production? Yes, you could do. We do a little bit lower energy for that, but yes, we could do it that way. A little bit lower heat, I should say. Are there people who don't have volume loss and don't require filler? Yeah, definitely. Most people, actually. Most people don't have volume loss, actually. I don't only treat like very severe scars. I treat mild to moderate scars all day long. And most mild to moderate scars don't have volume loss. Well, actually, most of my consults today as well didn't really have much volume loss. They were saying, should we do filler? I was like, I don't think really there's much going on with the volume right now. Let's just hold off on that right now. So I ended up not doing it, actually. I'll say like, well, let's first try this first step and see if we need any volume. It's like, I'm not sure. To me, it looks like we could get away with just softening it out and you don't need volume. But I'm saying you need volume, Like this patient needed volume. You just need volume. There's like no way around it. You just need volume sometimes. Sometimes you just need it. So it's like, there's nothing else you can do about it. What is a typical amount someone could get a subcision? Usually just do it one time. Just do it really effectively one time, once, twice. But beyond that, really, really wild. Audrey saying, so would subcision and CO2 laser mostly improve those without fat loss? If there was no fat loss, subcision with CO2, yes, it would help. And then maybe with TCA Cross for those ice pick scars. Max is saying, can subcision be done for scars right next to the eye between the brows? seems hard to do it there. Yes, you could do it there. Yes, there's a way to do it. There's certain cannulas that I would use to break up that scar tissue over there. I absolutely could do it. There's actually no place on the body I have not done subcision. Interesting. Kind of interesting, right? There's no place on the body I have not done subcision. You can do it anywhere, really. Kind of interesting, right? And there's ways of doing it. Like, you got to be safe with it. Like, little bits, like, you don't have to go like crazy with it. You don't use every single tool that you have for that. But yeah, there's ways of doing it actually in every part of the body. Because a lot of times, if the scar is tethered and stuck, there's nothing that's going to improve it as much as doing that. What treatment did the patient? So yeah, to recap again. So I'm wrapping up right now, but because I was off for 2 weeks, I decided to stay on for a little bit longer for you guys. I did talar liberal subcision for this patient. I did TCA Cross for this patient. Did blunt cannula subcision. Someone reminded me to say I did blunt cannula subcision along the jawline area. I did. Actually, you know what? I actually forgot. Now I remember now and again. I did excision as well. You actually could see the excision where it was in that deep pocket of scar right there. That actually was an excision mark there. And then I also did Bellafill for the patient and dilute Radiesse for the patient and fully ablative CO2 laser. And then we had to do a few times for this patient. Let's see here. Audrey saying, I got a subcision on acne scar and ended up with stitches and the scar or stitch scars. How can I decrease the appearance? And that's something sometimes you may just want to do a little bit of someone could do a little bit of saline injections underneath there, pop it up, and you usually break it up there. How much does the treatment cost? Usually most patients are about $5,000 to $7,000 for their scars. Most people. What laser is good for hyperpigmentation and brown skin? Pico laser. Pico is the best for pigmentation. I'm going to wrap it up for now. You guys know I'm going to be on for the whole day, for the whole week. Well, actually Monday through Thursday. But I'll be back on my regular schedule now. So just so you guys, everybody knows, sometimes I'll be just a minute or two behind. But let me know if you had any particular pressing questions too. I had a lot of questions in my mailbox. Sorry, I was on vacation, and I was saying earlier that I was originally planning on still doing things and like interacting and stuff like that. And I was actually still I was going to post I was in Spain, and I was going to post cool stuff that I was seeing and things like that. But I don't know. I just felt just living through everything. And I was just I'm with my kids, and I was just I don't even feel like posting much. I didn't feel like looking at things. I didn't feel like posting much. I just want to relax and not deal with social media too much and stuff like that. It was actually really good. I honestly, I recommend everybody doing that. It was just no stress and not worrying about pushing something out there and just at least for a couple of weeks and just relaxing like that. It was actually really, really cool. So just highly recommend for anybody is feels the pressure sometimes. Sometimes you're in you're sitting there at dinner tables with friends or something like that, and you're trying to chat with them, and everybody's just taking a photo and they're distracted from you. And it's man, we could just enjoy this moment right now, and instead of taking a photo to showcase to your Instagram followers, and so I feel that sometimes you're sitting there your kids and stuff like that. You really want to take a photo of your food, really. I don't even know if anybody gets excited about food anymore, photos from an IG anyways. But anyways, I'm just saying that sometimes it's just gotta relax with the social media portion of things. So I did that for a couple of weeks, but I'm back now, so I'll share a little bit more about you saw this morning I was watching Little Baby Bumps. So I'll show you guys a little bit more about my slice of life again though. For at the moments that make sense there. Is this from chemical peeling? No, this is with ablative CO2 lasers, subcision, as well as collagen fillers. I appreciate everybody. Thank you guys so much. And can the patient still see the scars in a dark room with angled flashlight lighting? It's the worst light. Yes, don't do that. Don't sit there in a dark room with angled flashlight lighting. That is absolutely the worst light. Absolutely. You'll still see this patient's scars in that light. Don't sit there and do that. Don't do it. What would you gain by sitting there with the worst possible lighting in the world? What world do you need to have a flashlight sitting over there and dark light and someone looking at your scars? So don't do it. All right, guys, I appreciate everybody. Thank you so much. I'll be on tomorrow and some of the collagen